Hi there, I'm Sara Sheehan, and welcome to my podcast, Transformational Thinkers with Sara Sheehan. Today, I'm talking with Samuel Hale. Sam is an entrepreneur, innovator, and CEO of Nurish'd, a platform that partners users with registered dietitians and leverages AI to integrate personalized nutrition seamlessly into customers' lives by connecting users to healthy meals that best fit their lifestyles and goals. Sam believes if we eat well, we feel well. Welcome to the show, Sam.
Thanks for having me.
I am so glad that you're here, and I'm so excited to see what you're doing and how you're transforming the ability for people to own their own fitness and wellness. So let's dive into it. Sam, your backstory is critical to what got you here, but I'd love to hear what led you to create Nurish'd.
Absolutely. I mean, generally speaking, Nourish is really the evolution of our previous endeavor. And it started off as a meal preparation company where we were literally just making and preparing healthy prepared meals for individuals. And that was mostly just being delivered direct to consumer. But we wanted to start bringing more value because we noticed that the space was very saturated. And to do that, we actually started integrating dietitians into our workflow and allowing the dietitians to work with our clients one-on-one to make sure that what they're eating is actually optimal for them. But what I didn't know was actually how much time that would take a dietitian to be able to do all of that work manually. And so the food industry already has really tight margins. And what we were noticing was that once a dietitian would meet with a client for an hour, they'd have to do their charting. And on top of that, they would start doing the meal planning. And it's quite difficult because when you have a food producer that has a large menu, the dietitians had to know all the ingredients, all the nutrition facts, and everything else that would be required to optimize the macronutrients and caloric intake for an individual. And so what we kind of brainstormed was that, okay, well, what can only a dietitian do? And that's really the consultation one-on-one and also the charting for, compliance and insurance purposes. And from there, what we did is we started optimizing the meal plans using AI. But what we wanted to do is basically implement a system that would allow dietitians to do what they do best and then kind of automate part of their workflow. And that's kind of what led us to the idea of Nurish'd. Fast forward a little bit, to today's day and age is that we wanted to be able to reach as many people as possible. And we knew we couldn't actually do that just by owning the infrastructure of the food service facilities. And so now what we're doing to kind of scale into more demographics is to actually, and demographics and geographics, I guess we could say, we're now scaling with additional ready-to-eat meal partners, and we're really that technology solution for them. And so we have two ways that they can kind of integrate with us, and that's either being on the marketplace where we're now the client-facing platform that provides the digital health solution, or we can actually license our software to help them optimize within their own companies. So that's kind of the journey from a food producer into more of a technology play.
Because you started in the ready-to-eat meal prep space, right?
Correct.
And you realized that you really needed a way to capture and attract those customers.
Yeah, and I mean, even more so to attract and retain the customers is that we wanted to actually provide more value. So by having the dietitians, not only do we provide, medical nutrition therapy, but having the food service, we could provide the food product as well. And so now you don't have this intermediary between a dietitian over here and a food service company here. We kind of have it all in one place. So it's much more of a value add. And beyond the customer retention is that we're also now looking at this as a health play, right? So we see a lot of the information coming through for food as medicine. We have medically tailored meals, we have reimbursement in the insurance space. So we are really now, from a customer retention standpoint, it's actually now more of a patient retention standpoint where we're trying to actually better people's lives by using, food as that first step.
And so are you looking to then work with benefits groups that would offer your solution to companies as something that they could provide for employees as well?
Yeah, and we're already doing that, which is awesome. So
That's awesome.
yeah, actually in your neck of the woods, we have a partnership with Every Health. Some of their employees are Dallas based, but primarily Texas. We're providing our platform Nurish'd as the medical nutrition therapy platform by providing telehealth services with RDs. And then if the members of the insurance company have CKD, which is chronic kidney disease, hypertension, obesity, or diabetes, they do get approved for our Nurish'd membership, which also includes meal credits, which they can then reimburse through the insurance company. And so now we're seeing payers provide our services as a solution to people who are kind of battling diet-related chronic illness.
That is absolutely remarkable. I am so glad to see that you have numerous ways to attract incredible customers and to keep them clearly. It's a very viable and sustainable business model.
Yeah, we hope. I mean, there's kind of two ways to look at it. I mean, from the medical side is that we do want people to go into remission and obviously get better. But the thing is, like, we don't become not available when they do get better. So it's, although it may not be covered by the payer once they reach a certain goal, they're still able to access us and pay out of pocket as well. So we're always around, and it's kind of up to the the members or users to determine when to use us, right? So yeah, I mean, in the perfect case scenario, I think it is a feasible business model. I'm confident in it. Mm-hmm. Of course, being involved with health systems, it's a little bit difficult, and policy changes. But I'm very optimistic with the new narrative of what's happening in the U.S. I just got back from a conference last week in Chicago, and there's a lot of excitement in this space. And I think that the insurance companies are excited too because they want healthier patients. So we'll see how it goes.
That's phenomenal. And so let's talk a little bit about how the software actually works and where you may be using AI and what the customer experience is like.
Yeah, so we've been using our AI now for just over a year. Believe it or not, we actually had an administrator before hand select meals for our users depending on dietary preferences. But now we've been kind of testing that AI internally for just over a year. The way we use the AI is in a few different ways. So it is proprietary to us. We've developed it in-house. But what we do from a user standpoint is that we understand three things about them, right? Their health profile, their activity profile, their bio profile, and then in theory, a fourth profile, which is their taste profile. And this kind of goes hand in hand with us offering microbiome tests as well, because we can understand what foods someone should consume or not consume, I guess you could say, and then also the amount of food someone should consume. So we have a lot of data that has to be optimized. And so what we do is when we partner with a meal prep or a food service company, we have all the data of their recipes, their menus, the ingredients they use, and make all their compliance labeling for them. But because we have all that information, we can then optimize it for the macro and micronutrients that someone should be consuming. And so that's the first way we're actually have implemented and are currently using AI in our current marketplace. The second thing that we have in beta and in development right now is like the agentic AI, where we're actually using a chat-like feature where someone can interact with it. And right now it's actually learning from all the customers and the dietitians that we're using on the platform, because currently AI cannot make recommendations for dietary needs. It has to still come from a registered practitioner like a dietitian, but we are getting to that at some point into the future, right? So right now we're allowing our clients to manage conditions, and it is suggested by AI, but it's reviewed by dietitians, and then it's signed off by the dietitian. When it comes to lifestyle intervention, like weight loss or muscle gain or even maintenance, we are making those recommendations without dietitians, but it's not to manage any kind of diet-related illness. So that's kind of how we're providing this information at the moment.
That's amazing. And so in your software, does someone actually have a record of, for instance, how many calories they've taken in every day based on the plan that's generated with the dietitian?
Exactly. So beyond calories, we also go into the macro and micronutrients. So let's say we have a patient living with diabetes. They may want to watch their dietary fiber, and we can actually set benchmarks to optimize for that amount of dietary fiber. Same thing goes for a CKD patient with phosphates, sulfates, sodium, and things like that, right? So all that is available on our platform. And one thing that's really important is that we have a health profile, and that health profile actually helps the user track their progress, but it also helps us report back to the insurance companies from a plan adherence standpoint. So we are collecting that data, are using it for the patient's advantage for sure.
That's wonderful for the patient, the dietitian, and I am assuming that their doctor can see this as well. Is that correct?
That's right. So the doctor can actually request the charts from our RDs, so that will be available. Again, one more thing that the RD can do is actually make changes to the meal plan that the system has recommended. And the more feedback we get from the dietitians, the actual machine learning model takes that all into consideration and will make more optimized or more optimal recommendation in the future. So it goes from both the user standpoint and the dietitian standpoint to start training the AI to be more reliable.
I'm wondering right now, just because this is personal experience, my spouse is a diabetic and he is on an Omnipod and a continuous glucose monitor that is looped. And so I'm wondering if the meal plan can be added to the program somehow so that it knows exactly what's in the meal. Because right now they build a model for what they're eating, if that makes sense.
Yeah, no, it absolutely could be built in. We don't have anything like that. We do have, future features that we want to build, which are nice to haves, which we're not quite there yet, but that would be including a recording CGM data. And I mean, us, having an API where we can, provide our meal data to another software is not off the table. Maybe when we get Make It Big, we can implement that feature.
There's a world of opportunity there that could really influence a lot of people's health in a positive way. That's very compelling. And so, Sam, talk with me a little bit about where your customers are and about your business reach from a location and geography perspective.
Absolutely. Right now, I'll take a step back, and we started in Canada. So our headquarters is here in Calgary, Alberta, but we've just made our entrance into the US. And the nice thing is about having a digital health platform is that it's scalable depending on the licensure of the RDs or the dietitians. And so from a telehealth perspective, we are actually available in quite a few different states. And then from a food as medicine standpoint or a ready to prepared meal standpoint, we have a USDA approved or USDA inspected food provider in the Texas region, which can actually ship meals to the lower 48. So in theory, we could be statewide. However, from a, I guess, what's the word I'm looking for? From a strategic standpoint, we're actually just only rolling out in the main states that have, one, issued the 1115 waiver, and two, have been implementing our programs to their policies, which is Every Health in Texas. So our next stop is actually going to be in Illinois, and we're partnering with a local company there to start offering medically tailored meals as well as the digital health platform in Illinois. So right now, we'll call it Texas and Illinois, but not so distant future, we could definitely be rolling out nationally. It just depends on resources, basically.
And the 1115 waiver is?
That's basically a tool that Medicaid, Medicare is using to be able to provide insurance for people to have their meals reimbursed. There's other ways to do it as well, but these are the states that have been most progressive. So some of the other ones would be like California, New York, things like that, right? So the nice thing is that it's kind of where the population is already quite dense. So there could be a lot of potential customers from a platform standpoint. But yeah, I mean, we'll see where we get pulled. We have a lot of good conversations that are open right now. We just want to make sure that we're focusing on the right things at the right time.
Wow, this is so exciting. I can't tell you how wonderful it is to hear that your expansion is literally on jet fuel.
It could be. It could be.
This is literally a really wonderful inflection point to be having this conversation. Where would you say you are in the arc of building your business? I mean, you've come a long way since we first talked, for certain, but how would you define where you are? Yeah,
I think we're just crossing the chasm right now, so to speak. We've put in, a lot of that sweat equity and the hard work, and now it's figuring out how to deploy what we've learned into the market. So from us, it's really, like you said, rocket fuel is going into the commercialization stage, and that's what we really need help with the most. And, what we're trying to do is, get that brand awareness, have that B2B sales structure where we can work with the payers directly, and then they can acquire the the consumer for us. And so that's the main point of our business at the moment. But I mean, yeah, it's like you said, we've come a long way since we chatted, but it hasn't been an overnight success either. We have been working on this, for years, but it's nice to kind of see the fruits of our labor kind of coming together. And I feel for the first time ever, unfortunately, that the timing for this is really good. We've done things that are too soon, too late, but I feel like we're right in the sweet spot at the moment.
I definitely think large organizations are in the right place to make the choice to have a benefit like this available for employees, much more now than ever.
I agree, and you'll notice that a lot of them are self-insured these days as well. So it definitely brings that flexibility. And if you look at some of the studies out there from like an employee benefit standpoint, a lot of them are looking for meal solutions at the office. And I mean, a lot of the tech companies do it. I was in San Francisco not too long ago, and a lot of the companies do provide lunches and dinners and everything in between, right? So it's definitely a compelling business case for a larger company to provide this type of benefit, but it's going to really depend on the company's culture, right? So we're seeing, like, we haven't gone necessarily the route of going to the companies directly. We're really trying to work with the payers and the plan sponsors to be able to push us down instead of us being pushed up by the company. So there's no right or wrong answer. It's just figuring out kind of what's the best sales flow for us. And we're still figuring that out, quite honestly.
Well, working on where you need to be in the process in terms of customer acquisition, if you're constantly looking at what works and what the best outcomes are that you're getting, you're going to be doing the right thing.
I hope so.
Excellent. What aspects of your business will you be developing next, Sam?
Yeah, that's a great question. Like, we have a laundry list of stuff that we want to include on the platform, but we have to make sure there's a good feedback from our clients first. The next big thing for us would just be to make sure that we have that plan adherence piece that's for the insurance companies, just to make sure that we can provide them an ROI, because there has to be a benefit for both the patient or the client and the insurance company. We're a really small and lean team, so we do as much as we can as fast as we can. But those would be that's the next biggest step for us. Apart from that, it's going to be building a network of payers that we can make sure that we have a good relationship with, because the reason why we needed a national reach is because a lot of people are insured by different payers across the country. And of course, it's not only going to be limited to one state. And we need to have multiple vendors. We have to have multiple dietitians. We have to have microbiome tests that can reach other clients. And so for us, it was just to make sure that we have a wait list of vendors. So then when we expand into certain states or provinces, we have access to the right resources that we need. So those are the main things I would say.
I know, Sam, that you're very growth oriented. What big leap are you working on in your business right now?
Yeah, I think growth is a tricky one, right? Like, we always joke and we make food puns all the time over here, but businesses often die from indigestion, not starvation. So we want to grow at a sustainable pace. Right now, we're trying to figure out what that looks like, and we haven't quite mastered it, but we're bringing on the right resources. And so I think the biggest thing for us, like from a leap perspective, is that we're a small and agile team, but we have to start bringing in the right people for the job. And I think letting go a little bit of that control is going to be a learning curve for all of us on the management side. And I'd say that's the biggest thing that we have to come to grips with right now.
It's talent is something that is an equation that is hard to master.
It seems that way. And I mean, kind of like when we had the dietitians, building the meal plans manually, we want to make sure they can only do what they can do. So what we've been doing is a lot of different things within the company, and people wear many hats, but it might be time to dial down and focus on that, that B2B salesperson or the commercialization officer or whatever title they want to have. I don't care. But something like that will definitely have to be kind of niched in and determined.
If you were to take a step back, what do you think your biggest challenge is right now?
Yeah, I think one of the biggest challenges is that our platform does so much, and it's hard to be everything for everybody. And so the more we try to please everyone, the more we're not pleasing anybody. And so what we've noticed is that when we've been going to market with our ideas, we're saying that we do this, this, and this. And it's like, wow, like, how do you manage all of that? So we start to feel it after a while. And so what we're really trying to do now is dial in on what our offering is, who we're helping, and making sure that we understand that our total addressable market is going to be large enough for us to have a sustainable business model, which based on what we've determined it is. And yeah, I mean, that's kind of what I would say for that one.
Mm-hmm. I'm sure there's not a lack of challenges.
No, we usually learn things the hard way as well. So, I mean, just from challenges, and that's learning different healthcare systems, right? We go from, Canada to the US, billing, clearinghouses, copay, all these like terms that you guys are very, very familiar with. We don't have that here necessarily, right? So we're learning a lot in the healthcare space, but we're also learning a lot in the food space. We're learning a lot in the technology space as well. So it just gets a little bit heavy, but we're handling it well. It's just a big learning curve.
Mm-hmm. I would think that in the current administration in the U.S., that the head of Health and Human Services would absolutely love what you're doing.
I hope so. If you know him, you should, or her, get me in contact with them.
We can see what we can do about networking that purpose. I do think they would be very much in favor of what you're doing and how you can affect people's health in a very positive way. What big goals or aspirations are you currently working on this year?
Yeah, I think this segues nicely into that because, one of the things we're mentioning is that we're helping people, manage conditions, but it would be nice to be able to prevent conditions as well. And so one of the biggest things that we have to kind of compile together is opportunities where we can provide science-backed results for prevention of chronic illness using food as medicine as well. And so, I mean, that's one of the things that we're really aspiring to at the moment. It's one thing to, help someone feel better, but it would be even better if they didn't have to feel that way to begin with. Mm-hmm. So, I mean, that's something that maybe not this year, but we want to work towards it so we're ready into the future. But yeah, the biggest aspiration apart from that is just, helping as many people as possible feel better using our resources, but then also just scaling and helping the people that are in need as well. Because what we notice is that people who are, chronically ill in a lot of scenarios are also kind of food insecure as well. And so we're seeing how the markets that we're entering can be affected and bringing, positivity to those areas. So yeah, it's a heavy question, but it's kind of the stepping stones, one thing at a time, right? Right foot, left foot.
Mm-hmm. I can only imagine that food insecurity is directly linked with much of what you're doing. And so having the connection with health programs and benefits is going to help get it in the right hands for certain.
I hope so. Fingers crossed.
Fingers crossed. What are you learning right now, Sam?
A lot of different things, that's for sure. I'm learning how to manage, a team of people among diverse areas. We have still our medical team, we have our technology team, we have our operations team, and things like that. So that's been a big factor. But even in addition to that, it's not even the types of individuals; it's also the geography of them as well. And so now that we're scaling into the U.S., we have employees in the U.S., we have employees in Canada. And it's really just figuring out which best way to interact with each of them and kind of managing from an arm's length instead of being in the same office. Mm-hmm. From a technical perspective, we've been learning a lot of regulatory going into the US, specifically in the food and medicine space. And on top of that, it's always, the next big thing in AI. And we're trying to stay on top of it as best we can, but things evolve so quickly. We learn something new kind of every day. And we're using it to our ability the best that we can internally, but as well as, turning those into tools that our clients and users can use as well.
Mm-hmm. And so how has that been for you when you learn something one day and that you realize that you need to then take it into a software development conversation? How hard is that to be that responsive?
We're kind of in a lucky position. Like we're very agile when it comes to a team, and we're also a very young team. And most people who we're working with on a day-to-day basis are reading the same information and learning about it. So if I don't bring it up, someone else will bring it up, this new big thing that they're seeing. So I've been pretty lucky that way. But again, it's prioritizing resources, and our team can only produce so much. And it's also getting the customer validation. I think one of the big mistakes people make is that they see this big shiny object and they think to themselves, oh, like we could really use this. But then they don't realize that there's a kind of a technical debt behind that, where they're going to put their efforts into this piece instead of something else that's maybe more functional to the business. It might cause an issue down the road somewhere else. So we try and bring everything that's relevant to the table, and then we really try and pull back pieces of it to say, okay, is this really needed right now? Can we maybe revisit it into the future? Or maybe it actually is like a huge opportunity for us, right? So it just depends on the circumstance, but it's just navigating it is going to be on a case-by-case basis.
Mm-hmm. Wonderful. Sam, as you take a step back and look at where you are there other things that you'd like to share with us today? What else is coming to mind?
I have to think about that one a little bit. I think that, like you mentioned, this current administration, I think that we'll just bring that topic up. I know people, like it and don't like talking about it, but I think that there is like an optimism in the air, and it seems that, the movement of making America healthy again. And I mean, we're seeing things here, like if you look at our social media news feeds, we're getting bombarded with the same information, like removing food dyes, really understanding the artificial flavors and colors. Small things like that, I think those are really positive changes in the long run. So I think that there has to be something to say about that, and that's kind of an important thing. I'm bipartisan. I'm on the outside looking in. Doesn't matter to me necessarily, who's at the helm, but I think that there are good things happening. So it's kind of refreshing to see that, and I'm just hoping that the momentum continues.
Yes, well, I believe and know that the momentum will continue, and I believe you will have exponential growth this year.
I hope you're right.
Thank you so much for your time today, Sam. Tell me how our listeners can find you.
Yeah, you're welcome. I mean, I'm not that active on social media, but the best place to find me would probably be on LinkedIn, and that's just my full name, or it might even just be Sam Hale. Our company's also on there. We have all access to our websites, and we have 2 separate websites, again, going to this compliance thing. We have our technology website and our marketplace website. So I'd be happy to just send you those in a quick link. And then if you want to share those with the listeners as an appendix, we can definitely do that as well.
Absolutely. All the information will be in the show notes.
Perfect.
Thank you so much for your time today, Sam.
Thank you. Likewise, I really appreciate the opportunity. And I'm glad that, I think we spoke probably over a year ago, maybe longer. I'm glad that we were able to pull this together. So I appreciate, the opportunity and your time as well.
Absolutely. You are definitely one to watch, in my opinion.
Thank you. I appreciate it.
The 3 key takeaways from today's episode include human-centered, tech-powered nutrition. Nurish'd started as a meal prep company and evolved into a technology platform that combines registered dietitians' expertise with proprietary AI to deliver truly personalized, health-focused meal solutions. Real impact, broad reach. The platform is already making waves, partnering with benefits groups and insurance payers to provide medically tailored meals and nutrition therapy to those with chronic illnesses like diabetes and hypertension. Data-driven progress. Users get tracked nutrition insights such as calories, macros, and more, enabling patients, dietitians, and even doctors to collaborate on health goals, all while nourishing healthier habits at scale. The intersection of AI, telehealth, and nutrition is just the beginning. Kudos to Sam and the whole Nurish'd team for blazing a trail toward a healthier future. As always, subscribe and never miss an episode.